Hello, today we're going to be talking about taking control of your neurogenic bowels. As a disclaimer, please read this information, and if you need extra time, please pause. Reflexic bowel is when our nerves from our spinal cord are not communicating with both our rectum and our anal sphincters, and so the ability to have a bowel movement on our own is impacted. Thankfully, with reflexic bowel, our body is able to respond to digital stimulation. That means the stimulation of a finger in the rectum, as well as medication inserted into the rectum that can stimulate a bowel movement. Before doing full bowel care, we want to prepare. And so first, we want to make sure that your bladder has been emptied. And so that could mean using a catheter to empty your bladder, or if you're able to pee on your own, make sure you do that first. Bowel care can happen daily or every other day. Typically, while you're in the hospital, it's going to be daily. Depending on what your body did prior to injury, you may work towards every other day if that's better for your body and your life. And then for those that are able, eating or drinking something warm 20 to 30 minutes prior to bowel care can be really helpful with stimulating another reflex called the gastrocolic reflex that helps move the stool through the intestines. However, if you're unable to do this, bowel care will still work with the other steps that we'll discuss. So for positioning, upright is always best when possible. If you think about it, our bodies are used to being in an upright position for having a bowel movement. We have gravity on our side. And so working with your occupational therapist to determine what's the best equipment you're going to use for completing bowel care is really important. Here are some examples of padded options, and then thinking about how long you're in the position for and making sure pressure reliefs are happening. This first one is a padded drop arm commode. This is a tilted tub buddy system. This is a self-propelling padded wheelchair with a side cutout, as you can see, to potentially help with ease of access. And then depending on your mobility and your balance, if you're able to transfer onto a padded tub transfer bench with a commode cutout, that is also an option. For those of you who this maybe isn't an option, or if you're just having a really bad day, laying down and completing bowel care from your left side is an option. And you would just need your right leg bent to allow ease of access to the rectum. Making sure that you lay on your left side is an important factor. And if you're going from here, say, to another facility before ideally going home, then it is important to make sure that you direct your care and know that the left side is the side you want to lay on. Gathering supplies, we want to make sure that you have gloves available. It's going to help with just ease of cleanup. And then water-based lubricant. It's bolded because you definitely need to have that when doing the digital stimulation. An underpad is not bolded because depending on if you're able to do bowel care directly over the toilet or if you're doing it into a bucket, having it for ease of cleanup, or if you're doing it in bed, an underpad is definitely necessary. But if you're able to do it into the toilet, it's not necessary. Wipes are also optional because you can use regular toilet paper. However, most people prefer wipes. And then the stimulant or rectal medication, either the suppository or the enemies, is needed. So you can talk to your occupational therapist about assistive devices, such as the examples here, which are a long-handled suppository inserter and a long-handled digital stimulator. When going to insert the rectal medication, it's really important to note that prior to inserting the medication, you want to put in a gloved, lubricated finger and gently check to see if there's any stool just waiting to come out. If there is, you want to hook and remove that stool prior to inserting the medication. Then you would want to insert the medication, either the suppository or the mini enema called the enemies, as high as you can along the rectal wall and wait for that to take effect, which can take about 5 to 15 minutes depending on your body. The next step is to actually perform the digital stimulation. So with a glove, lubricated finger, once again, going into the rectum and in a circular motion going for about 15 to 20 seconds, keeping contact with the rectal wall until you start to feel that sphincter relax, and then you move your hand. Stool should start to come out. Wait about 5 minutes before you attempt that digital stimulation again. Most people will take several rounds of digital stimulation, and then you'll know that you've finished bowel care when you can no longer feel any stool left in the rectum, or if your anal sphincter starts to tighten. And if you have some sensation, you may be able to feel that you're fully emptied. And then wipe and clean up when bowel care is finished. Oftentimes people will choose to shower after this. Typical bowel care takes anywhere from 30 to 60 minutes. So just keep this in mind. If your bowel care is going over an hour, you definitely want to reach out to the doctors to figure out what can we adjust: diet, oral medications, positioning, what are the other options if reflexic bowel care traditionally is not working for you. Other things to discuss with your doctor would be if you're having frequent bowel accidents. It is typical in the beginning when we're retraining the bowel to have accidents within the first 2 weeks, but as long as we're being really consistent and following the steps of bowel care, that should resolve and improve over time. So if you start to have frequent accidents, reach out to the doctors. If you have diarrhea that lasts more than 24 hours, if you have little or no results. So with this, if you know you're going through all the steps, you've been eating normally and hardly anything's coming out, you would want to reach out. If you have concerns for a blockage, if there's the presence of blood, there is a risk of hemorrhoids with bowel care. So anytime you see blood, you want to reach out. And then shortness of breath with abdominal expansion. So for those who are able to breathe on their own, if you can't take a nice deep breath and you start to feel that your abdomen is a little bit larger and maybe firmer, that'd be a reason to reach out, as the stool could be getting backed up. And then for those who have a spinal cord injury at the T6 level or above, you are at risk for a condition called autonomic dysreflexia. If this is the first time you're hearing about this condition, please take a moment after this to watch that video. However, if you do not fall into that category, you don't need to worry about it, but essentially it's an elevated rise in blood pressure. So once again, to summarize the steps of bowel care, complete it at the same time each day, drink something warm or eat something prior to bowel care if you are able to. Make sure that your bladder has been emptied prior to bowel care. Gather your supplies and get in the recommended position or on the recommended equipment. Make sure you've managed your clothing. Check the rectum to make sure there's no stool present. And then insert the medication. Wait that 5 to 15 minutes depending on how long your body takes. And then begin the digital stimulation, which needs to happen for 15 to 20 seconds each time. And that can be repeated after 5 minutes. And you'll know when you're finished, when the rectum starts to tighten or you no longer can feel any stool left. I know these are a lot of steps and a lot of numbers, so if it's helpful, you can pause this video and leave this on the screen while you're completing bowel care here with us, or save this video link and watch it when you're at home. We can also print this on a piece of paper if you'd like to have the steps as you're learning and directing your care. Lastly, clean up and you're done. And hopefully good bowel care will help promote you being able to do things and not being worried about having bowel accidents. What questions do you have? Please feel free to reach out to the medical team with any questions related to bowel care. And if you have a moment, please take this survey.